Detroit's #1 news station. News Radio 950 WWJ.
While we're continuing to see a spike in coronavirus cases, we have been answering your questions about the virus each weekday. Coming up, we'll be speaking live with Dr. Roy Elrod, Chief of Staff at DMC Detroit Receiving Hospital. And if you still need to go to the store to pick up groceries for Thanksgiving, be prepared to brave the crowds. Also, we'll tell you how to get into the holiday spirit if you're not quite there yet. Good afternoon. I'm Brooke Allen for WWJ News Radio 950. Also coming up this half hour.
On this day before Thanksgiving, college basketball moves into the spotlight as Michigan State, and Oakland University begin their seasons today. Those stories and more straight ahead in sports.
Use caution out there on the roads. We do have scattered showers, also some fog reported, and 2 freeway closures. We will check traffic and weather at 12:38. WWJ News Time, 12:31. While we are continuing to see a spike in coronavirus cases, we have been answering your questions about the virus each weekday at 12:30. And joining us on the live line today is Dr. Roy Elrod, Chief of Staff at DMC Detroit Receiving Hospital. And Doctor, I guess the day before Thanksgiving, I have to ask you, how concerned are medical professionals about holiday gatherings?
Oh, well, first of all, thank you so very much for having me on. I would say there is concern. However, I can tell you that our hospital is very prepared for the second surge. We've had opportunities to prepare, and there's been significant protocols put in place so that we're absolutely prepared to ensure that patients can come in and have a very safe and secure environment for very safe care that they expect and deserve. So we're ready.
So the cases that you've been seeing lately, have they been as severe or less severe or about the same?
You know, that's a great question. And our first, I think, round with this, not as prepared and no other therapeutics out, I think we visualized there were very severe cases. Now, I think if you add the fact that we've got some elements of therapeutics to kind of treat things, we've had an opportunity to put in place some protocols to try to mitigate the spread. It could be they don't seem as bad, but they're clearly spikes that can be seriously concerning. So I'd say it just depends on how that patient is when they come in.
So have you seen any impact on the cooler weather and the number of cases of the virus?
Yes, and it's all expected as the weather changes and you get people more inside and more crowded environments. It allows for easier spread of the virus. And so that's what we're seeing, and it's happening pretty much nationwide, and that's what you'd expect.
You know, I have to ask you, I know on social media, I've been seeing it a lot also with 2 of my friends. They said they did everything right, social distance, didn't go out when they didn't have to, wore a mask, washed their hands, everything, but yet they still got COVID. So can you tell us a little bit about that?
I think all we can say until we have a vaccine is that we know for a fact masking, social distancing, as well as hygiene dramatically decreases the risk, but it's not 100%. And so what you find, though, is places that have implemented strict standards, as we have done in our hospital, the opportunities for spread of the virus is reduced. So to say that someone actually contracted it after doing everything, it's possible, but I can tell you that having those elements in place dramatically reduces the risk of spread, and we see that much more often.
So we have been hearing positive news on vaccines. When one is rolled out, how long do you expect it to be before the virus numbers start to fall?
That's a great question. And I think time will tell in terms of the real efficacy of the vaccine. Obviously, if it's something that's 99% or 100%, hopefully it will begin to dramatically decrease, as we've seen maybe in terms of a polio vaccine and other vaccines that have been very effective. But I think time will tell, and we won't know for sure until it's actually out.
So can you tell us the general attitude and morale at the hospital? I mean, how are all of you feeling in healthcare? You've been dealing with this since March, and now the second wave is here.
Yeah, I think we've been very fortunate to have an upbeat spirit by the team here, because I think we've been preparing for it, and we've made sure that we got the necessary equipment and supplies, the PPE. We're all engaged from our administrative leadership to our medical staff to our nursing. So we're all on board, and I think that helps in terms of being prepared. And so we're ready. We encourage the people that work in our facilities to make sure that they're protecting themselves both within the hospital as well as outside, because we want to make sure that we're safe, our loved ones are safe, and particularly that our patients are safe if they come and see us.
What about your staff? I mean, has COVID been diagnosed among your staff? And if so, how many people have contracted the virus?
Yeah, so we do try to keep a track of that. And from the physician standpoint, we've had a few that have, given the fact that we're obviously at a greater risk because every day we come into a facility where we're trying to effectively treat these patients. But it still is, I think, very minimal. We haven't had a significant. We're prepared and we're staffed to see this second surge. So it hasn't been a dramatic impact.
And, we've spoken to doctors all this week about that people, if they are experiencing a medical emergency other than virus symptoms, they should definitely come to the ER, correct?
Absolutely. And that is probably the most dramatic point we need to emphasize, I think, even on this information call today, is that what we've seen is that patients now are delaying their care in significant harmful ways, particularly those that have chronic illnesses, heart disease, lung disease. Those patients generally will now hold off if they have symptoms to the point that they become in a critical situation. And by the time they come in, now their disease has impacted them so much it's more difficult to treat it. And we want to avoid that. And that's simple enough to avoid if they just, when they get those symptoms, do what they would do before COVID, and that was come to the emergency department. We are a safe facility. We're able to make sure that they're put in a place that's separated from any COVID patients, and that those that need elective surgeries, that need, colonoscopies, mammograms, those things that can prevent serious illnesses, they don't need to delay that care. They should definitely come in and be seen.
Doctor, I have one more question for you regarding Thanksgiving. If people do gather in small groups tomorrow for Thanksgiving, do you recommend that they quarantine after just to be safe?
I think that could be something to consider. However, if they've done the things that they should do and no one has symptoms, that hasn't been a CDC recommendation that I've heard. So I would just say that, mask, hygiene, social distancing, that things that they've been doing should continue unless they get a positive test on one of the persons that were involved with their Thanksgiving.
Okay, thank you so much. Again, we have been speaking to Dr. Roy Elrod, Chief of Staff at DMC Detroit Receiving Hospital. Coming up next on WWJ.
A new genetically modified wheat that could